Now would be a great time to unmute yourself and speak up. And all right, without further ado, because time is short, I would like to introduce Dr. Sarah Kemble, the state epidemiologist. She just have a few quick comments about where we are as far as case counts, hospitalizations, that kind of thing, kind of where we've been, where we're headed, what the trend is like. But so many of you have so many questions on so many topics. We wanted to give you this opportunity to get as many questions in with Dr. Kemble as we possibly could. As always, you guys are pretty good at taking turns and speaking up and not speaking over one another. Please be aware that a lot of people are recording this for broadcast purposes. And so stepping on each other or stepping on Dr. Kemble's answers kind of spoils the fun for everyone. So we'll get through as many questions as we possibly can and just kind of go around the room. And you can raise your hand if you'd like. Otherwise, when there's an opportunity, you can just chime in. Again, you guys are always really, really good at this. So let's see if we can just do that without raising hands. And Dr. Kemble, thank you very much for making time in your schedule. You can unmute yourself and let us know how we're doing. Thank you all.
Thanks, Brooks. So I'm looking at today's numbers, and today our daily new cases 7-day average is at 706. This may indicate a slight reprieve in the numbers that we've seen, but we're definitely not out of the woods yet. And I want to talk about why. We are continuing to see very high numbers of cases. Remember that a month ago, 700 would be an incredibly alarming case count for our islands. We also know that there is a lag still between when we see cases and when we see hospitalizations and deaths. And tragically, we do anticipate seeing many more deaths reported out in the coming weeks from the cases that we've already learned about. So these are factors that impact us as we're going about our day-to-day business. They also are really impacting our hospitals. As we know, the hospitals continue to address critical issues with shortages, whether it's addressing the shortage in oxygen last week, shortages in beds, and continuing to try to provide excellent care to those patients who are coming into our hospitals. So I think we're definitely not out of the woods. Another factor that we have to consider is some variations in testing from time to time. So holiday weekend, not sure that people were out in droves to test as they might have during other times. So I think we really need to see how things unfold in the coming week before drawing conclusions about where the case numbers are. In the meantime, I do hope that people have taken to heart the mitigation guidance about keeping it in your households, avoiding large gatherings, staying home when you're sick. And if we continue to do that, we could see a true decrease in the case trends, which is going to be much needed.
All right, questions from the media.
Hi, this is Annalisa. Can I start?
Absolutely.
Okay. So Dr. Kemble, can you give us some, I guess, perspective on the pediatric case counts and how concerning it is? Because when we talk to doctors and the hospitals, they say that that is where the biggest concern lies. And if we're seeing that trend continue.
We are seeing more cases now than ever among pediatric populations, about a quarter of our cases at last look. Part of that is related to the overall rise in cases. So as the total number of cases go up, we're going to see more children who are diagnosed and who ultimately end up in the hospital just because the overall numbers are increasing. But we're also seeing that creep up a little bit as a proportion of all cases. This may be partly driven by vaccine because the groups that are left that don't have eligibility for vaccination are our youngest children. And so we are seeing some increase in proportion in cases in that group, which is our unprotected group. So that's one factor to keep in mind. When we do try to look at severity of illness, we're still tracking what the national case hospitalization proportion has been, about 2%. That's still what we're seeing in Hawaii too. So we aren't seeing an increase in the severity of illness among these pediatric cases, but we are seeing more children infected. Oh, you're on mute.
Oh,
Okay,
just a quick follow-up about deaths. If we've seen any pediatric deaths.
I'll have to check our numbers. Sorry?
Just the one.
Yeah, still just the one. I don't think that's changed.
I guess I had my hand up. What kind of data do you have on breakthrough cases at this point? I mean, how many of of our new cases are people who have been vaccinated, and are there any deaths in that area?
So as of August 26th, we had documented 2,419 COVID-19 vaccine breakthrough cases in Hawaii. This makes up about 7% of all COVID cases in the state since January, and about 0.3% of the fully vaccinated population who've ultimately been diagnosed with a breakthrough case. Part of how we ascertain breakthrough cases is by case investigation, that we have to call people and ask them if they've been vaccinated. So this is likely an undercount of the true numbers because we don't reach everyone to find out that information. But we do have a better look at it when we look at who's in the hospital, because usually those people have their vaccine records reviewed. And so we do hear from the hospitals that we're seeing maybe 10 to sometimes 15% of those in the hospital who are vaccine breakthrough cases. I think there's a couple things you have to keep in mind when you think about vaccine breakthrough cases. One is the more we have infections circulating around us, the more breakthrough cases we will see. Because while we do know that vaccines work, they're highly effective at preventing hospitalization and death, they don't prevent every infection from occurring. And if you have enough infection pressure around you because you're surrounded by infected people, you will have some of those breakthrough cases. Where we tend to see more of the hospitalizations are in older individuals and those with multiple comorbidities. These are people who might land in the hospital after getting the common cold sometimes, or other common viruses like influenza. So that some of that is to be expected, even though it's unfortunate.
Dr. Kemble, could you?
Sophie, yeah.
Could you update us on what's going on with the Mew variant? There was a national report that indicated that it had been detected in Hawaii, but it looks like subsequent local reporting found that you guys are saying that it, in fact, it has not. Could you just clarify what's going on there? And then also, are you concerned about it, if it does come to Hawaii?
We have had a few cases of Mew variant here in Hawaii detected through our whole genome sequencing program with the State Laboratories Division. Most of those were detected back in June. Similar to other jurisdictions that have seen Mew, we saw a few cases during that summer time period that seem to have subsided at this point. We're not seeing continued detection in the most recent runs. So Mew has not been called out by the CDC at this point as a variant of concern. It's not one of the ones we have tracked on the variant report, which is why you may not have seen it there. Part of what makes a variant of concern is not just the characteristics about that particular strain, but also what's the propensity of that strain to take over and become the dominant strain. We're not seeing that with Mew. We're really seeing that Delta seems to have found its niche here, and that's still well over 95% of the cases we're seeing in the state. So our current problems are really driven by Delta, not Mew.
Hi, it's Christine Donnelly at Kukua Line at the Star Advertiser. I wanted to ask about booster shots. There's a lot of confusion. I'm getting a lot of questions about who's eligible. Can anyone just go to a pharmacy and get a booster shot? Or is there a hierarchy of availability in Hawaii for booster shots? In other states, people are getting them pretty widely and easily. And so I'm hearing from a lot of readers who are asking about what's going on here.
Right now, booster shots are something we're trying to distinguish from the third dose that you would give to an immunocompromised individual. So the ACIP, the Advisory Committee on Immunization Practices, has come out with recommendations that if you're severely immune compromised, so if you have cancer and you're on chemotherapy, if you're taking really high dose steroids every day, certain conditions that would make it difficult for your body to mount that initial immune response, 3 doses is recommended instead of 2. That's the only current recommendation we have for additional doses beyond the 2-dose series for mRNA vaccine. So for booster shots, we are all awaiting further review of the data and emergency use authorization from the FDA before providing recommendations on boosters for the general population. There's a couple of reasons why I wouldn't recommend running out today to get your booster shot. One is that we still don't have great information on when to get it, what the impact's going to be, which populations are going to benefit from it. There's a lot of unknowns out there that we still don't know about boosters. What we do know right now is that if you haven't had a single shot of vaccine, you will greatly benefit by getting that full series done now. So our first priority is making sure those who have not yet been vaccinated go to get vaccinated now.
Jürgen Steinmetz from eTurboNews. How do you evaluate the risk we're taking with accepting visitors, specifically those visitors that still arrive without vaccine to the state?
You know, the program that we have in place with Safe Travels attempts to address that by having the testing requirement before arrival. So we're at least screening that you're not having people board a plane who are actively infectious. We also strongly encourage people who arrive after travel to get another test 3 to 5 days after their arrival. And this would provide additional reassurance that you weren't incubating infection when you traveled. Vaccination, of course, is the #1 way to prevent infection. So getting vaccinated prior to travel is your best bet.
And of course, this is kind of wishful thinking. I would think, I mean, a visitor coming here is here to go to the beach, to go on vacation. They're not coming here to get tests. Can we force visitors? Do you think we should force visitors, maybe this way, to get the second test? This hasn't happened here.
I actually think probably the best way to prevent infection from spreading from someone who maybe inadvertently or intentionally arrived infectious is to implement all the mitigation guidance that we're talking about. If people are taking great care in all public settings, at restaurants, at retail establishments, by masking, by keeping their gathering size limits small, then you're not going to see widespread transmission, even if you have that inadvertent introduction from a traveler. So mitigation in many ways covers all those bases.
Hi, Dr. Kemble. This is Christy from KH1. Going back to the Mew variant, I guess, what are some of the characteristics and what do you folks know about the variant?
Mew was raised as a variant of interest by the WHO because it has mutations that both confer increased transmissibility and potentially can impact vaccine effectiveness. So vaccines that we have right now may not work as well against it. But the other thing that a variant needs to become a true variant of concern is the ability to outcompete other strains and become a dominant strain circulating. That, at this point, we are not seeing with Mew.
Could you elaborate on that point a little bit more? With the Delta, if it starts to wane, as it moves through the population, would then the Mew variant have more of like an opening to spread? Is that something that tends to happen in terms of the way that variants work their way through populations? And the same with the Lambda variant. Is that also something you're concerned about as the cases with the Delta variant go down? Would another variant then be more, would its chances of spreading increase?
There's still a lot that the scientific community is trying to learn about the different variants. This is definitely a huge area of unknowns. And we have seen ecological shifts in which variants seem to take over in a certain geographic area, and then sometimes in large geographic areas like Delta has really become the predominant strain worldwide. So there's still a lot of things that we don't understand about what drives a certain variant to become the dominant strain.
Hi, this is Stephanie at the Tribune Herald in Hilo. Dr. Kemble, can you talk a little bit about like what, if anything, is different with the Delta variant in terms of like the incubation period? You know, does that 6 foot 15-minute exposure threshold still stand considering the transmissibility? Yeah.
The Delta variant too is still being studied to see how it may differ from other strains that circulated last year, for instance. But at this time, the preponderance of data from the Centers for Disease Control and Prevention are still showing that Delta's characteristics in terms of how it transmits are pretty similar to past strains. What we do see is increased transmission, probably related to the viral burden. So how much virus replicates once it infects you, and then if you have additional viral load, you're going to be more infectious to others. But the ways in which it spreads seem to be pretty similar. We're not seeing dramatic differences in how transmission is occurring in the real world. I think people have been concerned by the one-off reports of, okay, there was aerosolized transmission that went further than 6 feet, or you'll have individual instances of shorter transmission. Those are things that actually have been reported with other strains as well before Delta, and that you're going to see from time to time. But when we look at the overall dynamics, when we investigate clusters, it's still very similar to what we saw before. If everybody's practicing the standard mitigation guidance, wearing their mask, keeping 6 feet apart, we're not seeing widespread clusters develop that are out of what we would have expected prior to Delta.
I see Annalisa has her hand up.
Yeah, thank you. Just to follow up on the discussion about breakthroughs, Dr. Kemble, can you explain why we are seeing such a huge surge despite, 78% of our population that are eligible for these vaccines, at least here on Oahu, are, we're still seeing a lot of infections. What can we be doing that actually we haven't done already to help lower these case counts?
The number one thing is vaccine. And I think what we've learned from Delta is we're going to need higher coverage rates to really slow the spread as much as we would like to. So we are definitely seeing the benefits of vaccination. I believe that if we didn't have the coverage rates we have now, the hospitals would have been underwater long before now. That still is not saving us from the scenario we're in now, where we need to layer mitigation heavily on top of that to stay on top of this surge. So yes, Delta is different. It is clearly more transmissible. We are learning that unfortunately, if you're fully vaccinated, you can still be infected with Delta and you can still transmit it to other people. But what the vaccine is doing is protecting you against those most severe outcomes. So hospitalization, death, really critical illness. And that is a huge help to the community overall, because that is far fewer people filling our hospitals, and we can focus on those who are needing the care right now.
As a follow-up on the breakthrough cases, you mentioned it might be undercounted. I mean, is there any estimate that how many of these cases were missing?
I don't have an estimate for general cases, but like I said, if we look at who's in the hospital and what the hospitals are tracking in terms of the proportion of people currently hospitalized who are breakthrough cases, we still see that the vast majority of those in the hospital are the unvaccinated people. So that's really what's causing the primary burden on our hospitals right now.
If we can, let's jump over to Maui and Kay.
Hi, thanks, Dr. Kemble. This is Kay House-Doriza with the Maui News. Can you discuss the state move to ration healthcare and release liability from hospitals and healthcare workers? People in Maui historically have been concerned about their level of care, and with this order, we're receiving a lot of questions about whether residents will receive less care than before. Has this happened before, and what does this mean for people seeking non-COVID related treatment at the hospital?
I think what you're raising is exactly the reason why we still aren't out of the woods. We're still facing a situation, a dire situation in the state, where many of our health systems are overwhelmed and overtaxed and saying they can't keep this up for much longer. And we know that even if we stop new cases cold today from happening starting day one today, we'd still see an additional burden of hospitalizations and deaths yet to come that we haven't even been able to count yet because they haven't happened yet. But those infections have already happened, so that's coming. So I think we have to keep in mind what a precarious situation we're in. There was discussion back during the H1N1 pandemic of whether healthcare rationing would need to be enacted. We avoided it then. We hope to be able to avoid it now, but we really need the help of our community to follow the limited gathering size limits, to wear their masks, to stay home when they're sick, to do all of the things that actually prevent transmission here now today, to prevent ourselves from getting to that place.
And we only have a few more minutes. Is there anyone who has not yet had an opportunity to ask a question that would like to ask something of Dr. Kemble? Zoe.
Hi, can you hear me?
Yeah.
Okay, perfect. Out of all the deaths this week, do you know how many were vaccinated and unvaccinated?
We've still had, at this point, only 8 deaths reported among fully vaccinated individuals. And that's through the August 26th data set. So I don't have updated numbers since that date.
Are we taking further questions? I had one about testing. You know, with you know all the requirements, the vaccination requirements in the workplace. Do we have enough testing available? Do we have enough supply out there? Are people waiting to get tested? Are we seeing that? And then on top of that, you know, converse to that is, are we seeing an increase in vaccination rates because of these mandates that have come in recently?
We definitely have a testing shortage right now. You can see for yourselves the lines of people lining up to get tests. So we are aware that demand is outpacing supply. I do think some of that is driven by the employer mandates, which are for vaccine or test. My concern is that maybe preventing some people who are sick from getting a test, and those are really the people who should take first priority for testing. Vaccine-wise, we are seeing a rise in vaccination rates right now. Hard to know what exactly is driving that. I think some of it is the work we continue to do to bring people the information they need to make that decision. I think more and more people are impacted by COVID on a day-to-day basis right now. So I think more people are seeing their families impacted, their loved ones, and understanding how vaccine can benefit them by preventing that risk for themselves and for their families and loved ones. But as you say, we also do have, with the mandates, there may be some pressure for people to, it's going to be a lot easier to go get your shot than to stand in line every week for a test like that.
And I do know that Christy Tomashiro at KHON has a question she'd like to ask.
Yes, hi, Dr. Kemble again. I just wanted to see if you folks are concerned about reinfection at this point in time, you know, people who have had COVID early on getting reinfected at all.
It's definitely a concern because we have seen reinfection reported, especially when a new strain comes along and takes over. We may see reinfection for people that had a different strain previously. However, again, having natural infection does provide some level of immunity. So we do recommend still getting vaccinated because it's going to provide extra protection against reinfection. But the key here really is if you haven't been vaccinated yet, now is the time to go do it.
And it is 2:01. I do know that Dr. Kemble has to run. I don't know if she has time for 1 or 2 more questions. I do see that a few hands are still up. Zoe, are you stretching or is your hand still up? All right. And Kay, how your hand is up as well. Don't know if you got your question addressed from Maui. All right, anybody else before we cut Dr. Kemble free to go back to the important work she does?
Brooks, I had one other question. Sorry, I don't know how to raise my hand.
That's okay, Sophie. What do you got?
You know, early on, we had talked a lot about antibody studies early on in the pandemic. And I think the Department of Health had indicated that it was also going to be pursuing antibody studies to sort of get a sense of what proportion of the public had was being infected by COVID. Were those studies ever completed, and do you guys have a sense of the level of disease burden in Hawaii at this point in terms of how many people have been infected with COVID?
As time has gone by, we've learned that the serologic markers are less reliable than we had hoped to provide that kind of snapshot picture. So they can be helpful on a population basis, and there have been some looks through the blood donation programs at seropositivity rates in Hawaii, which overall up to date have been quite low actually. The recent surge probably will move that somewhat, but really, we had very low seropositivity rates in the state coming into this surge, and that's probably part of our vulnerability here.
So can you specify what those rates were, and are they indicative of the percentage of the population that was infected?
Since those are limited to people who give blood, it's hard to know how representative that is, but we would typically see less than 10% on most of the surveys. So, you know, the thoughts about how to use the serologies, those techniques are still being developed and newer serologic techniques are coming out, but it really is probably best applied in research settings where you're looking also at PCR-based testing and comparing those things, because trying to do an individual test with an antibody to see if you need to be vaccinated or not, that may not even give you the correct answer. There are people who we know who have been vaccinated who may not mount an antibody response, may still be immune because maybe their T cell response or their cellular response is acting to protect them. So it's not a perfect indicator of immunity. And we also know people that test with antibodies and still get infected. So it's not a perfect correlate of whether you're susceptible or not.
All right, and I know we've run a few minutes long. I do have a text from someone who is asking if Dr. Kemble can give guidance for people who are on quarantine. And Dr. Kemble, I know we got to cut you free, but that's really important that people adhere to quarantine, isolation or quarantine, that they follow the guidance, they do what they've got to do to reduce transmission. So do you have guidance and information you'd like to share for people who are quarantined?
Yeah, that's really key. So if you know that you've been exposed to someone who tested positive for COVID-19, you want to try to stay home and separated, quarantine from other people outside of your immediate household and even within your household to the extent that you can for 10 days. So that's the 10-day period from the last date that you had exposure to that positive person. So if someone in your household tested positive and you are still seeing them every day, you've got to wait till they're cleared from isolation before you count out the rest of your quarantine period for another 10 days.
All right. Dr. Kemble, thank you very much for your time. I appreciate it. We will cut you free now because I know you do have a lot of work to do. Hey, everybody, we are, as she said, we're certainly not out of the woods yet. I just counted up, we have had we have reported 37 deaths over the last week, 37 deaths over the last 7 days. Just tragic what's happening. And I appreciate all of your efforts to share information that will help us bring this pandemic to a close, at least quiet down the current surge is happening, because it's absolutely tragic. Thank you all for taking the time today. We very much appreciate it. Talk to you soon.